So this horse has just come from the field with a puncture wound on the sole of its foot. A puncture wound is defined by a wound that is deeper than it is wider and is caused by a thin sharp object, for example a nail, which means that the wound carries a very high risk of infection, as a small entry wound can hide a massive infection. The main infections that can occur when a puncture wound is found is tetanus and a strain of bacteria called the Clostridium bacteria, which also can cause malignant edema and acute wound infection, which are very dangerous and can cause fatalities if the horse isn't treated early enough. The main reason why this occurs is because debris can be trapped inside the wound, and because of the small entry hole, the wound closes up very quickly and the debris can't escape, which can cause massive infection and abscesses, which if not drained can create a massive pressure in the foot, which can be very painful and is shown with acute lameness. Now we're going to dress this foot as if it had a puncture wound. To dress the foot, you would thoroughly wash out the foot, pick it out, and make sure everything's clean and the wound's thoroughly disinfected. So to treat this wound, you would place hot or cold poultice, and this we're using a piece of paper, but you would use either a bran mash with Epsom salts or kaolin, which is a white clay, which again we mix with Epsom salts, or you would use a ready-made poultice by Animal Intex, which come in shaped pieces for the feet, or they come in large pads which can cut to size. So we would soak this either in hot or cold water. Hot to draw infection, cold for bruises, and then we would place it in the hoof, moulding it down to the foot, and then we would take our bandage. You would normally use a wrap, but in this we're using an X-ray bandage, and place it across. And after this is poulticed up and the bandage is secured correctly, you would use gaffer tape to secure it, or you would put on a hoof boot, which prevents any more infection and prevents them walking through the bandage and again introducing more infection. So the main worry with puncture wounds is how deep the wound is. If the wound is very deep, it can cause major issues with the major tissues around it. This is especially true in puncture wounds on the legs and on the feet, because there's a lot of tendons and ligaments in there that can be severely damaged. The main ligament to worry about is, the main tendon to worry about is the deep digital flexor tendon, which if the horse damages this through a puncture wound and infection gets in, then there can be severe damage, and surgery is the only option. And even if surgery is carried out, there's not a lot of horses have recovered properly from this injury and have severe recurring lameness. This is especially bad if the horse has the injury on the foreleg, as the horse carries 65% of its weight on its front end. If this does occur, then, as I said, there isn't a very good recovery rate. So with the aftercare of a puncture wound, it's essential to change the poultice every 12 hours to let the foot breathe and stop it becoming soft and weak. It's also essential to alternate between wet and dry poulticing, so again the foot doesn't become weak. Ideally you wouldn't want to poultice any longer than a week, just to prevent the foot from becoming soft and weak. And if the infection or the wound isn't closing up after this point, ideally you would call the vet out in case there is any debris stuck in there, and it could cause further problems, such as an abscess or problems with the internal tissues of the foot.